put their knees and hands down. You can kind of, if they have more thoracic issues, you can have them kind of slide back so the flexion is kind of coming through my sternum. Or you can have them roll forward so that most of the flexion is coming down through my lumbar spine and pelvis here.
So this takes a little more core stability.
Sure,
than
yeah.
the basic version.
It's not for everybody. But it really works. I mean, it's nice. It's comfortable. It feels really comfortable having something underneath me. Okay. Any questions? Angry cat, prayer stretch, ball flex. And then likewise for extension, same thing. I would probably not have someone do this on that. Take the ball and just have them extend back. Okay. And you can have them put their hands behind their head so they're not kind of getting that whiplash effect. I usually have people put their feet apart just so they have a nice wide base of support so they don't roll off. And usually I'll have my hands on the ball to stabilize it until they feel like they're really set. Okay? And just have them take some nice deep breaths. And as they exhale, go into a bit of a deeper stretch. Okay? And same thing, you can have them position on the ball if you want to isolate the more thoracic or you want to emphasize the more lumbar. I have seen it before online where people try to extend their knees a little bit, but that again is a little bit more, it's a little higher level, but certainly adds to the effect of the stretch. Okay, so for lateral flexion, so for flexion, we talk about doing that prayer stretch where we reach forward and then I bring my ischial tuberosities down towards my heels. Well, to promote some lateral flexion, you can do the same thing. So you go to this position, and then you kind of have the patient crawl their hands out to one side. So you can kind of feel the stretch on the side that they're opening. So it would be the opposite side of the side my hands are moving to. Okay. And same thing, I can bring my chest down towards the table to feel more stretch. I can reach a little further to feel more stretch, or I can sit back a little further to feel more stretch. This is a good one, and that's a really good one. Side lying over pillows, supine and standing. I think I already showed that. Right?
You did, yeah.
So instead of just having someone lie like this is the basic. And I actually feel a stretch, sadly. You can have them progress to a top roll, and then you can have them progress to a bolster. So, and we already showed different ways to modify it. Standing again, basic is just a reach, and then the more intermediate is where you cross the back leg behind the other one, and then you can reach a little further. So, this is a good one. So, for most of your patients, hook lying rotation will be sufficient. You have them lie with their feet flat and they'll move side to side. If you want to intensify the effect, again, this requires more core stabilization. You can have them put their calves on the ball, hands down to stabilize, and then, you have them do as much rotation as they can without feeling like the ball is going to slip out from underneath them. I'll have them start with a very limited range of motion. Typically, you're going to ask them to engage their core because otherwise, if they don't, they're going to flop all over the place. So you want everything really stable here, the trunk, okay? And you want to go to the point where you start to feel either a little bit of a stretch or that the ball is going to fall out. So again, this is almost like a form of active assisted range of motion, right? I'm going through a range of motion, but I'm using something else to help me gain a little bit extra. Okay, any questions? How are we doing? Okay? Now, as far as advanced exercises, there are a lot of different ones out there. Yoga certainly incorporates a lot of the more advanced stretching for the spine. And if someone needed a specific kind of range of motion for a specific activity, we about. And sometimes for these more advanced things, where it's not as intuitive, you actually have to spend some time learning about the activity. So I've spent time, fortunately I've actually been able to go and watch some of these people do their activities, or I've had someone capture a video on their phone, and technology makes it so easy now. I've had people take, had videos made of themselves, had people take pictures of themselves doing their activity, and I've just spent time educating myself about certain things to help them get their best outcome and get back to what they need. So everything's very patient-centered, right? And then Beth and I were talking about a couple of examples that we thought of. I thought we had a yardstick. We don't know, huh? I don't know if this will work or not, but
See what the body like?
yeah, that's fine. That'd be good. So I don't know. I've seen people do this at the gym. An advanced rotation exercise is where you have like a barbell and you hold on to it like this, and then you kind of do the rotation and stance, right? So you're using a little bit of weight, which creates some torque as you rotate, and you have to kind of resist it. So you're using your obliques somewhat, but you can use it to kind of ballistically create some range of motion if you go fast enough. Okay, so that's
Two, same thing there.
use the effective weight. And then what about the pipe? I don't know, how would you piece one?
Yeah, so just, I know, people who've been in cheerleading and gymnastics and things like that, and part of something they have to do
Be able
is
to do that.
a pike position, so you're down on the floor and just reaching into the pike position repetitively. You're strengthening, so we'll talk about that with our dynamic active strengthening as well, but just whipping yourself quickly into these positions, Gesundheit, or lying with your back straight and whipping your legs back.
Right,
You know,
right,
I've
right.
seen that a lot for strengthening, but you're also forcing that range of motion as well.
Sure.
Anytime you're doing that quick ballistic movement, almost all of our advanced exercises that are ballistic, that are yoga-based or Pilates or anything like that, you're strengthening and stretching at the same time. You're gaining movement while you're strengthening because you're pushing yourself further into a range ballistically. So there are definitely crossovers on most of our advanced exercises.
Yeah. So if most of our patients, if they can do advanced stuff, most of the time they're probably appropriate for discharge or independent HEP. But again, there have been cases where someone really needed to get back to something, and I said, well, I want to learn about it. And I do that all the time in my practice. I don't know much about playing the viola. Tell me more about it. So if that's what they need to get back to doing, I need to know about it.
And that creates good buy-in for your therapy too, because if you can have your patient do something with their instrument, if it's a sport or an activity that uses an instrument or some sort of a prop, or just the fact that you're asking them specifically for them, then they realize you're not just giving them a cookie cutter recipe for exercise. Oh, all of my patients do this lumbar stabilization program and it works. No, is it going to work for you and your activities? We need to know that. So watch what they're doing. And oftentimes, like Brian was saying, I'll have them do whatever movement is in front of me and tell me where does it hurt when you do that, or what bothers you, what are you not able to do, what should you be able to do, and then go, okay, well, I can analyze. That's why you're doing a group assignment for your movement analysis, because you're going to be able to see where the breakdown occurs and what muscles we need to strengthen or where we need to gain more range of motion, looking at someone do their activity and go, oh, well, we definitely need to strengthen this motion. We need to strengthen these muscles or get you more range of motion so you're able to do that movement better. And that creates a really good buy-in, and that makes you a good patient-centered therapist.
Sure. You're more likely to participate.
Absolutely.